All right. Well, good morning, everybody, and happy Friday. We are going to go ahead and get started. We want to honor everybody's time on this busy Friday. My name is Samantha Crouch with the Holly Hill Chamber of Commerce, and I just wanted to thank everybody for joining in on the conversation today that we're going to have with our Department of Health here in Volusia County. Just to give you an idea of what we're going to be running through, we're going to start with a presentation, and the presentation is kind of evolved based on all of the questions and feedback that we have received of questions that our business owners are having in regards to employees as well as themselves and their patrons and their businesses. At the end, we're going to have some time for question and answers. All of our attendees, you are muted and we cannot see you, so please do not be worried about that. If you have not used Zoom before, you do have the option at the bottom of your screen. There is a question and answer bubble. So as you move along, if you have anything that you'd like addressed or anything you'd like to be touched on at the end, feel free to hop on the question and answer bubble, send it your way, and either myself or Robert will make sure we get that addressed during the presentation or afterwards. So send that in at any time. I would like to go ahead and introduce our guest speaker today. So Robert with the Florida Department of Health is the environmental administrator. He oversees programs for water protection, facility safety, sanitation, on-site sewage treatment, disposal systems, and much more. He's a technical advisor on the community health and indoor air quality issues, which is something that we received a lot of questions about for local, state, federal agencies, and professional associations. And he's also served on a variety of national advisory committees for healthy housing, indoor air quality issues as well. So with more than 20 years of experience in the environmental health and indoor environmental quality assessment fields, Robert is more than qualified to be joining us today, and we are excited to hear from him and some of what's going on over there with our friends at the Department of Health. And with that, I'm going to pass it on to Robert.
Okay, thank you, Samantha.
Yeah.
I want to thank you for inviting me to do the presentation. It's always nice when I can talk to people directly about some of these issues. So, okay, so in the presentation today, I just want to talk a little bit about the health issues associated with opening a business in a post-COVID-19 world. One thing before I do start, I need to tell you all that I will be making statements, conclusions, and probably rendering some opinions during this webinar, and I just want everybody to realize these are of me and do not necessarily represent a new or unheard official position of the Florida Department of Health. So, okay, so with that, so the core issue we have upon ourselves right now is that we cannot keep everything closed forever. But at the same time, we're realizing now that it's very doubtful that we're going to get to a zero COVID-19 risk for a very long time. So the challenge and the role for all of us is to somehow find a way to get everything back up and running while at the same time changing what we do and how we do it so that it can keep all of us as safe as possible while we do that. So one of the first things I want to do is arm everybody with some facts that they need to fight this virus. And to understand a little bit, by the time we get to the end of this presentation, about the why. Why the restrictions, why were the requests being made upon the businesses, and how did that relate to making everybody safer? So let's start out a little bit with some of the virus facts. I know you've heard a lot, but hopefully I'm going to tell you some things you don't already know. Coronaviruses were first identified in the 1960s, and there are 4 of them that are currently in global circulation at the moment. All coronaviruses cause some kind of a version of a common cold, the thing that we get every single year that either does nothing to us or takes us out for a few days. COVID-19 is going to become the 5th version of this virus in circulation this year. So when you hear COVID-19, COVID-19 is the disease, but the virus that causes the COVID-19 is actually caused SARS-CoV-2. And if you've heard that word SARS and you heard about things in the past about that name, you'll know why it was causing so much concern in the public health community. So how do coronaviruses spread in the environment. When I say in the environment, I'm not talking about healthcare environments. I'm not sure if I got anybody working in a medical background. So this is going to be, or a facility, but this is going to be more like on a retail office kind of environments when I'm talking. So what happens is basically this virus, it goes human to human, and it likes to live in our respiratory system. So when you think about breathing, and the other reason I'm going to be telling you this is it'll help you understand the PPE and the mask thing that we're going to get to a little later. So when we breathe, we are doing one of two things. We are either releasing virus-contaminated droplets into the air when I do something like this, or when we breathe in, we are basically vacuuming whatever I just coughed out into the air. I'm vacuuming that and putting it into my lungs or my respiratory system. Those are the two things that happen when we breathe. So when you look at this slide that Samantha has up here, basically, if you're within 6 feet of that person who's just coughed, sneezed, or even talking, that's the cloud you're walking into. You're standing in that cloud. So as you breathe in, you're vacuuming that cloud into your body. And so we know based on the basic science is that cloud tends to go out about 6 feet from the person. So if you're standing outside of 6 feet, you are not standing in that cloud. And what we've seen in this outbreak and the outbreak in other countries is that the primary way that most people are catching COVID-19 is through breathing that cloud within 6 feet of somebody. Another thing you need to realize is those droplets that you see in this slide, they typically can stay in the air for up to about 8 minutes. But most of them are going to quickly evaporate or they're going to drop to the ground. So with that being said, another way that we can infect ourselves is when our hands, or even if we've got gloves on, our gloves touch one of those droplets. It could be a droplet of spit, a droplet of mucus that's come out of our lungs that we've hacked up, any of those things. And then once we have it on our hands, if we touch our mouth, if we touch our nose, if we touch our eyes, it provides basically the door for the virus to get in and make it to the respiratory system. Now, the CDC has estimated that up to 50% of all the coronavirus cases out there right now are being caused by this respiratory route. And here's the thing you need to know. This is really critical. It's not what a lot of people know. The amount of virus concentration in an infected person's body is at its highest between day 1 and day 4. But, and this is a really, really, really big but, you don't have any symptoms typically until you get to day 2. So on day 1 and through day 2, you could be interacting with a perfectly healthy person that's spraying a concentrated viral load upon you. And the deal is with controlling our risk is you don't know. You don't know who that person is that's perfectly healthy spewing out that virus. So to control our risk, we basically got 4 ways to do this, to deal with the unknown. And that is to stay 6 feet away from everybody. We can wash the virus off of our hands, or we can kill it with hand sanitizer or rubbing alcohol upon our hands. Or third, we can wear something like a mask that can either catch the virus before we release it into the environment so that we don't have to breathe somebody else's cloud, or we wear that mask so that it somehow filters our air before we breathe it in. And another thing about the concept of social distancing is that when you hear that term, everybody thinks 6 feet, 6 feet, 6 feet. But there's another aspect of that. Social distancing also means reducing the number of exposure chances, the number of people that you might meet that might be the one person that's asymptomatic. So a lot of the things you've seen about how to run your businesses also involves reducing the number of chances that somebody infected with that coronavirus might walk into your business. Another thing I want you to know, because there's been a lot of misinformation on the lifespan of the virus and the travel distance and the time it can stay in the air. But here's a general rule of thumb. In outdoor environments, this virus will not live more than a couple hours. It's killed quite effectively by sunlight. It doesn't like heat. It doesn't like high humidity. Well, guess what Florida has a lot of? All three of those things. Now, indoors, the virus typically has a half-life of about 24 hours. So what that means is that if I had 1,000 viral particles on a surface, in 24 hours there would be 500 virus particles, and then in another 24 hours there would be 250, and so on. And so what I've seen on some of the CDC guidances is that they basically say after 72 hours, whatever virus was on that surface, it's no longer a health threat. But what you need to know is that under perfect laboratory conditions, the virus can live longer than that. It can travel further than 6 feet. It can stay in the air longer than 8 minutes. But what you need to understand is laboratory conditions very, very, very rarely exist in the real world. Okay, next slide, Samantha. Okay, so the responsibility for stopping the spread of this virus, it's really a three-way street or maybe a four-way street, depending on how you want to think about it. The responsibility is partly the business owner, it's partly the employees, and it's partly the customer, and everybody working together to make the reopening work. Because for this to work and for the virus threat to go away and for us to get back to a world that we consider normal again, all three of those components have to come together and they have to work perfectly to make this virus go away. And I was going to say the fourth one could be the health department, the public health, the regulatory arm, but really it's about those three, and those three working together well. So to make that happen, your business has to have a plan for reopening. And when I say a plan, I'm not talking about a 55-page written document that you put on the shelf. What I'm talking about is thinking through, how are you going to do this? It could be in writing, but it doesn't necessarily have to be. So these are some things that I want you to think about. These are things that I've seen that have been issues in places that have had coronavirus outbreaks in them. So one thing is both your customers and your staff may be afraid to return to work, or they may be afraid to patronize your business. What are you going to do to reassure them that your business does not pose a health threat? How will you make that known? If they're there, how can they visually see that and feel that sense of security? What are you going to do, or how are you going to handle your most vulnerable employees and customers? So what we know is that people who are over 65 and people who are immune compromised tend to do worse when they've been infected than people who don't fall into that group. And there's some other categories, but I'll run long if I talk about that. So how are you going to handle those employees? Like, you don't want to put that employee in the place where they're going to come into the most exposure risk. You may need to repurpose them or put them in the back room, so to speak. And then your customers. Are you going to want to encourage that over? If you have a business that primarily serves the over 65, that could be an issue. But if you have a mixture of different age groups, how do you handle that over 65 group? How do you keep them safe? The other thing you're going to probably be looking at, because you probably saw it in the criteria of the step-by-step plan for Florida's recovery. And by the way, I didn't want to go through that line by line, just because I think you probably have the details on that, but I'm happy to. If you've got questions about it, I can walk you through kind of what that says. But anyways, but the gist you probably got from that is you're going to have to modify your business a little bit. It could be how you do your business. It could be how the furnishings of the building itself is arranged or operated in order to provide the protection you need for your staff and your customers. Another thing that's come up, and you'll see in the guidance in phase 1 and phase 2, was that we're supposed to be screening our employees coming to work, meaning taking their temperature and screening them for symptoms like a cough. So on that, what I've seen is that, especially if you're a larger business, You're going to have long lines of people waiting to have their temperature taken. You're going to see people who find that really intrusive and take offense to even having to go through that and try to find secret entrances into the building. How are you going to control the access? How are you going to handle people who don't want to do that? Another thing, and this really is critical, because most of the outbreaks I've seen have been employees that want to come to work sick. And so I've got them in my workplace, and I'm sure everybody listening here has them in your workplace. You typically have two opposite spectrums employees. You've got the one that's trying to figure out how to game the system and not come to work, but you also have those people who, they're going to go to work, and it doesn't matter how sick they are. They're going to come to work, and those are the ones you got to worry about, because they're going to come to work, and they're going to make sure everybody knows that they're sick, exposing everybody, and then they may come home or they may come back the next day. How are you going to handle that situation? Because I can tell you from personal experience of trying to deal with this, people take a lot of offense when you tell them you're going home. They get really offended at that. How are you going to handle that situation? Also, another thing to think about are your break rooms, your smoking areas. And maybe there's a place in your business that staff tend to congregate together to talk, maybe between customers or during slow times. You've read a lot in the plan for Florida's recovery about, no more than 10 people. How are you going to keep people from congregating in bigger groups? How do you keep them away? And another thing I need to mention about the gathering and then the martyrs that come to work is that if somebody comes to work and they're infected and we identify them, we're going to do contact tracing. And what that means is we're going to find out how many people were in close contact with the person. And if all the people in your workplace were in close contact, they're all going to go out on a 14-day quarantine. And that could have the impact on you of anything from shutting your business down because you only have 14 employees to having operational issues because you don't have enough people to run your business. So the distancing and all can keep that from happening, and of course the exclusion can keep that from happening to your business. So that's why that's really important to think through, of the gathering and keeping them from doing that until we can get this risk down to an acceptable level. The cleaning and the disinfection and the PPE supplies, you've seen that written throughout the document: clean, 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 multiple times, disinfect, disinfect, and disinfect. So what the reality of that is that you're going to go through a lot of supplies. So the question you need to think about is, do you have enough supplies? If you don't, how are you going to get more? Because we know that it can be tough to find things like a can of Lysol or some bleach. So, okay, next slide, Samantha. So defending your defending your business against the virus. I'm showing you this slide. This is called the hierarchy of controls, and it's actually a very old occupational health concept. And basically, all of the guidance you read in these documents come from this hierarchy of control. And I kind of wanted to explain some of those things you've read and how it relates to this triangle. So the first thing you see, the first thing I want you to notice about this is that the pyramid's inverted and the bottom or the top, the blue. The most effective things you can do are at the top of this, and the least effective things you can do to protect yourself and your business are at the bottom of this thing. So as you can see, it says elimination of the virus is the most effective thing you can do. What does that mean? That means, well, obviously, if your business is closed and nobody can come in, you're not going to get the virus in there. So that's the most effective thing you can do. Secondly would be keeping infected people from coming in. That could be employee screening, could be monitoring your customers to make sure you don't get an infected person in there. And then thirdly is disinfection, is killing the virus. Whatever virus is in there is killing it. That's the most effective way at controlling your risk. Substitution, in the sense of this COVID-19 scenario, is not really used. Engineering controls. These are the things that you're going to do to break the pathway that the virus is taking to get from infected person A to non-infected person or clean business B. And so to do that, these are things like screening, like putting up the plexiglass barriers. It's excluding people for health symptoms. It's reducing the occupancy rate so we can spread people out. It's seating people outdoors. Oh, I'm sorry, I'm on the wrong thing. I'm sorry, let me start over. It's breaking the pathways of the virus. So what it is the plexiglass physical barriers, wearing a mask. Wearing a mask means not letting the person be able to breathe that virus out of their body. It is spreading the tables out. It is social distancing to keep people outside of the reach of the virus. Administrative controls would be things like not allowing your most vulnerable employees to deal directly with customers. It could be the screening and exclusions for health symptoms, reducing your occupancy rates, seating people outdoors, educational signs, and I think that was one of the questions. I'll go ahead and talk on that now. Unless you're in a nursing home or an assisted living facility, there is no requirement to put COVID-19 or coronavirus warning sign up. I recommend you do it, at least something for educational purposes to say, hey, if you're coughing or you've been on a cruise or you've been to another country, or, you know, all those things that you've been asked a million times, it's just good to make the person at least think about it before they walk into your place so that they're at least looking out for your business and don't go in and mess it up. The other thing would be one-way aisles, visual cues on the floors. And also one thing that we're doing at the health department, and I know some other businesses are doing, could be the telecommuting, letting people work from home, or also creating schedules so you don't have all your staff concentrated in one place at one time. Those are all administrative things that you can do. And then finally, you'll notice at the very bottom, the least effective thing is wearing the PPE, the personal protection. Why is that at the bottom? Because you would think if you have that mask on, you're safe. Well, the deal is that if you're wearing the mask, that means that you've allowed the virus hazard to come into your business. You're allowing it to be there so that if anything goes wrong with the personal protection, they've been exposed and possibly infected. And I think if anybody listening has ever had to wear like an N95 mask for an extended amount of time, you know how hard that is to have that mask perfectly sealed on your face for 8 straight hours. It's really difficult. Okay, next slide, please, Samantha. Okay, I want to talk a little bit about masks because that's what we hear about all the time on TV. So let me start out with the purpose of each mask. So at the beginning of the presentation, I talked about when you breathe, you're doing one of two things. You're either exhaling whatever virus you do or don't have in your body, or you're breathing in and you're vacuuming up somebody else's virus that might be in the air. So the purpose of the face mask and the surgical mask is to basically keep the virus from making it into the air. That is their purpose. The purpose of the N95 respirator, and you notice it doesn't use the word mask, it uses the word respirator, because the respirator is a word that's always used with things that we wear that filter our air for us. So that the N95 respirator's purpose is to filter out the virus that might be in the air before you breathe it in. Now that being said, you do need to know that the face mask and the surgical mask do filter the air, but they don't do it as well as the N95 respirator. So let me explain real briefly how what the research says. So on an N95 respirator, 95% of whatever virus particles that are in the air that you're breathing in have been filtered out. And that's what the 95 means in N95. Another thing I'll just tell you, it doesn't have to do with filtration. Well, it does actually a little bit. The word N stands for no oil, meaning basically if you get this N95 wet, it'll either not filter anymore or it drops the filter percentage. So this is actually on the 3M website if you want to go read it. If you spray that N95 with a Lysol can because you're planning on reusing it the next day, you will no longer be filtering 95%. You could be filtering out 80%, or you might be filtering out 20%. But we know it'll be filtering less the next day after you do that and every time you use the Lysol can. So a surgical mask Basically, the research says it'll filter about 60% of the particles you breathe in. And then on these face masks, it really depends on what your face mask is made out of. So if you use a cloth, high thread, like an 800 count cotton with multi-layers, and you put that face mask tight on your face and it fits perfect, you might get up to 60% filtration with that mask. Now, if you use a low thread, single ply count cotton or a synthetic, you're probably getting about 35% filtration. And this is what I tell everybody, is that any mask is better than no mask. So keep in mind what the mask and the purposes of the mask are for as far as the wearing of the mask. Another thing I need to mention that I don't think I've heard on TV or seen anywhere is that the CDC does not recommend you put a mask on a child under 2 years of age. And another thing I need to say is that since I've just told you that face masks were not meant for filtration protection, you can't use them as a substitute for social distancing. So that means if that person walks within 6 feet of you, you don't know if their mask is working. You don't know if your mask is working. You don't know how well it's working. So you're still being exposed. So that's why even if you're wearing the mask, you still need to maintain the 6-foot distancing. And briefly here, I just want to touch on gloves, even though it's not on my slide. So here's the thing with gloves. I just told you that the CDC says roughly 50% or up to 50% of the people are catching the virus by breathing it in. Well, if you're wearing a glove, unless you're wearing it over your mouth, which I doubt anybody is, that glove is doing nothing to protect you from that version of the virus. And I also told you, if you put your hands in a glob of hacked material on a surface, whether you've got a glove on or not, if you touch your face, you're going to expose yourself. So really the gloves, for the purposes of coronavirus, aren't really doing a lot for protection. I mean, if we're talking about foodborne illness, they're really important. But for this one, the gloves are not as much. But if you'll see in the CDC guidance, if you look at the PPE, they tell you to wear gloves. But there's some more variety of reasons for why they're telling you that. Okay, next slide, please. Okay, let's talk briefly about cleaning and disinfection in the business. And again, I'm talking about non-hospital, non-industrial kinds of applications here. So the purpose of cleaning is to remove dirt, but more importantly for our discussion today, cleaning is to reduce the number of viral particles that the disinfectant you use has to kill. And we talked about as your cleaning frequencies increase, you're going to need more supplies, you're going to need more labor time to do that work. You're going to need to look around your business and identify all your high-touch surfaces like your tabletops, your doorknobs, your light switches, countertops, phones, keyboards, faucets. What was the other thing I was going to mention on that? Now I'll leave it at that. Things that are going to be touched a lot. You've got to think about how you're going to clean them, how often. Oh, I know what I was thinking of. In the guidance for reopening, they said restaurants need to use paper menus or use a laminated menu. Well, if you use a laminated menu, you're supposed to sanitize that menu every time it gets used. So that's just a lot of work. It's a lot of extra work. Another thing you need to think about is on the PPE side. So you need to have the product MSDS sheets for whatever you're using to clean and disinfect with, because that's what's going to drive your PPE usage. So whatever that MSDS sheet says, that's what you need to use. One thing you need to be careful about is you don't want to use a cleaning method that could aerosolize whatever's on the surface. So that would be things like sweeping, using a vacuum without a HEPA filter, using a pressure washer or air spray, which I don't think probably most people are doing those indoors, but it's possible. All those things can aerosolize the virus, and then we're into a whole nother exposure issue. Another thing I need to tell you about, and Samantha, this is the one that had the EPA Endless link that I didn't have on my slide. Oh, you got it. You got it. Thank you.
Yep.
Okay, so if you look at this slide, the very last link where it says pesticide registration, list and disinfectant use against SARS-CoV-2. Whatever you're using for disinfection needs to be on that list because these are the chemicals that have been identified as assumed to work against the coronavirus. Now, one thing about the virus that's really good is that it's one of the world's most wimpiest viruses when it's out in the environment. Not when it's in your body, but when it's out there. Just about everything kills it, but not everything. So if you use something on there, you should be okay. So, and it's really hard to find this stuff, so go to that link. That's the best way to do it. Another thing you need to know, and this is a huge thing that I'm finding problems with in facilities, is you have to follow the manufacturer's directions exactly. So what do I mean by that? That means if you spray bleach or you spray your quaternary ammonium, your Lysol, on a surface and then you wipe it back off 10 seconds later, the virus is probably still there. So if you read the fine print on those bottles or cans, you're going to see must let sit for 1 minute. And I've seen them go up to an hour depending on what you're using. You have to do that. You have to let it sit on that surface before you wipe it for however long the manufacturer says. That's the number one way, like with norovirus, that's the number one way I see it spread, is people don't do that. So if your business operation requires that you need to be able to wipe that in 30 seconds, then you need to find a disinfectant that only needs a 30-second contact time. So keep that in mind when you're doing this. Okay, a little bit of guidance on different types of surfaces. So hard surfaces, that's pretty straightforward. You can use any of the N-list disinfectants to do that for you. If you're having trouble getting disinfectants and you just want to use bleach, because I've gotten this question a lot, so I'm throwing it in here. The CDC says that if you're going to use bleach, that you use 5 tablespoons or a third of a cup of bleach per gallon of water. I'm pausing on purpose so in case anybody's writing. Or you can use 4 teaspoons per quart of water. And if you do this, you will need a 1-minute contact time before you wipe it up. Now, one thing on contact time, if you want to wait 5 minutes, it'll work even better, but you only need a minute based on this. Or on a hard surface, you can use 70% rubbing alcohol. And you'll notice it's 70%. And if you read anywhere, they're telling you to use hand sanitizer that's 60% or higher, but they want the higher concentration because they assume the alcohol is going to be interacting with materials that may deactivate some of it. So that's why it's higher. Soft surfaces, if you can wash it in a washing machine, that's the best way to clean it. The dryer should kill the virus, so you don't need to put any chemicals on it. But if you can't launder it, then you're into using those N-list disinfectants, and you probably want to look to see what kind of fabrics it's safe for. Electronics, especially if you've got like a keyboard or your cash register, you may want to consider getting some kind of a wipeable cover to protect your equipment and make the disinfection easy. But if you can't do that, you can use alcohol-based wipes and sprays and allow them to air dry. That should protect your electronics. That's according to the CDC. I want to give you some general advice. If somebody you knew was COVID positive and was in your building, the general guidance is to close the area off used by the sick person till it can be clean and disinfected. The CDC recommends you wait 24 hours or as long as possible before you clean it. I think that goes back to maybe possibly aerosolizing some of the virus and dropping the viral load on the surface. You also need to think about every place that sick person went while they were there. You'll want to clean and disinfect all of those areas. And another thing you need to realize is that, and that's the reason I put the hourglass on the slide, is time is your friend. And let me give you an example. So we've got a shortage of these N95 respirators, and so I'm using respirator optimization techniques. And I just told you I don't want to spray my respirator with Lysol. So what I do is I've got several of them, and I do what I call rest them. So what I do is I just sit them off to the side and I let them sit for 72 hours because the CDC says that the infection threat will pass in 72 hours. So time can be your friend. So what the EPA is saying is that if, this is what they said if you wait 7 days, you don't have to do anything. But I just told you 72 hours. So there's a little bit of inconsistency in the EPA, I'm sorry, not the EPA, the CDC guidance. So you can use what you want, but officially in their cleaning guidelines, the CDC says 7 days. Outdoor areas. Sunlight, wind, and heat are going to do almost all of the work for you. So the only normal disinfection that you're going to need to do with your outdoor areas is just doing your high-touch items like maybe the entry doorknob, or if there's some kind of a rail people tend to lean against, something like that that's getting lots of contact continually. You'll probably want to hit those with disinfectants. And also if you've got outdoor dining, of course, you're going to hit your tabletops, any common touch items associated with that tabletop with your disinfectants. And I wanted to also touch briefly upon alternate disinfection methods. So this is what the CDC says. They say the efficacy of ultrasonic waves, which I haven't yet to hear of anybody using that, UV light and EV light is not known for COVID-19. So here's what I'm going to tell you. The ultraviolet or ultraviolet light for upper room and hard to reach place disinfection has been shown to work in the research literature on other viruses, but I haven't read any recent research of using those devices on COVID-19, but because they work on other viruses, this is just me, I would assume that it would work. Hydrogen peroxide is another one. These are these fogging machines that you might see that, excuse me, that people are advertising. You will see if you go to the end list that hydrogen peroxide is on the list. And as long as that list says that that has been approved for use as a fogging agent, it should work. But this is what you need to know. If you use that, you've got lots of prep time of sealing rooms, shutting off HVAC systems. There's wait times involved before somebody can go in because the hydrogen peroxide may be toxic to occupants. So if you go that route, it should work for you, but you've got a process involved. Okay, next slide, please. So on this slide, I just listed some helpful resources. Some of those I'm sure you knew. Some of those may look new to you. These are agencies that I use for references when I'm talking to the public or whenever I'm doing assessments or writing reports up. I try to reference somebody who's rendered an official opinion based on what experts are telling them. And one thing I wanted to mention was one of the most useful documents that I have found, and that is the last link on this slide. It's called the Master Question List for COVID-19. And believe it or not, it was put out by the Department of Homeland Security, of all agencies. And basically what that is it's just a big old compendium of questions that people tend to ask about COVID-19 and their answer. It's just like a dictionary almost, where you can look something up and get it. And I find that document very useful, and I recommend everyone download a copy for their own personal use. And with that, Samantha, do you want me to answer the questions that were sent in first, or do you want me to take questions?
Yeah, if you want to go ahead and touch base on the questions that were sent in, that'd be great. And then everybody, if you have any questions, again, feel free to use the Q&A feature on the bottom of your Zoom screen, and we'll go from there.
Oh, okay.
Awesome, thank you.
All right. So first question I'll handle is the exchanging money, which I've gotten that question a lot. So, okay, so let's everything I've just told you with the background, let's think through this for a minute. So, okay, so for the money to be a threat, that means that I had to have either hacked or spit or breathed onto the money, or I had to have contamination on my hands and touch that money with my contaminated hands. Those are the scenarios where the money may pose a risk. So the key thing that you don't want to do is you don't want to be taking that money directly out of the other person's hand. If you can do this, you want them to put the cash on an intermediate spot, preferably a spot that you can sanitize after you're done. And if you do have to handle the money, you could wear gloves or you could not wear gloves. It doesn't matter, because even if you take those gloves off, you're still going to have to wash your hands. So you can take the glove stuff out and just go wash your hands. But the key thing you need to remember here is that you don't want to touch your face until you've washed your hands or used hand sanitizer. And then also, once the cash has touched that intermediate spot, you will want to wipe your counter down with a disinfectant after that process is over. The next question was, does hand sanitizer expire? That's a really good question. I've got that a lot, and I know a lot of people have been talking about it. Okay, I haven't heard anybody actually answer this question other than, does it expire? Yes, it does expire. What does the expiration mean? Okay, so hand sanitizer has alcohol in it. I think it's ethanol and isopropyl alcohol, I believe. So because it's an alcohol, it's volatile, and that alcohol, even though it's in a gel form, it's going to evaporate out of the gel. So the manufacturers know roughly how long it takes for the sanitizer to lose 10% of its effectiveness. And that's how they come up with the expiration date. So if you're using a 60% hand sanitizer, which is the minimal amount that the CDC recommends you use, once the sanitizer is expired, it's no longer considered effective against the virus. But if you use a 70% or higher hand sanitizer, if you lose 10% of the efficacy, you still got above 60% hand sanitizer in there. So that means it still works. So that might be something to think about if you see that you're past the expiration date. And let's just say, for instance, your expiration date is 2 years after the day you bought it. So that means if you lose the 10%, it'll take another 2 years to lose another 10%. That's how you got to think about it. So if you had 80% hand sanitizer, which I think is really hard to find, if not impossible, but if you had it, you could probably go 4 years before that sanitizer doesn't work. So that's what you need to think about on hand sanitizer. The next question was, are there certain times or places you should not wear a mask? Okay, this is how I approach this. So if I put my N95 respirator on, I'm not touching that respirator again until I'm removing it, because I'm leaving the exposure environment. Because if I touch that mask, I run the risk of cross-contaminating myself. I run the risk of exposure. And in a normal world, what would happen is the second you leave the environment, say you have to go to the bathroom and you're leaving your exposure environment to go to the bathroom, you would just throw that mask away and you would get you a new one before you walked back into that environment. But we're not in that normal world right now. So what I would do is I would leave it on and I wouldn't touch it, because in theory, if you don't touch the mask, in theory, there shouldn't be any risk posed to that mask. Now, I guess it's possible if you're going to loan your mask to somebody else after they went to the bathroom, yeah, that might be a risk, but in general, you want to be wearing that mask as long as you're in an environment where you think you could be exposed. And that would be any place you can't maintain your social distancing, your 6-foot social distancing, or if you're inside and there's a lot of people in there. And then the other thing would be, if you're looking at the mask from the perspective you're trying to protect others, well, if you've walked into an environment where there's nobody else, like the bathroom stall, well, okay, in theory you can take it off, but because you've got barriers all around you, but you're in a bathroom, and if you touched it, you've contaminated your mask and you're into other issues. I think I answered number 4 here. Okay, I've gotten this question too. Is the health department visiting open businesses looking for violations? Who is doing so? If we see a violation of social distancing, who do we contact? Okay, this is going to sound like a convoluted answer, but it is the answer. So the health department will only be visiting open businesses that we regulate, which is probably not going to end up being most of the people on this webinar today. So if we get a complaint about a place that we do not regulate it, we'll do one of two things. We'll refer it to the agency that does regulate it. So if you are a restaurant, we're going to let DBPR know that we've received a complaint, and they'll do it. Or it could be code enforcement. What we've been told is that we're supposed to refer it to law enforcement, but I know a number of agencies are referring it either to law enforcement or to code enforcement. So that's what I would tell you to answer that question. And I partially answered this one. I'll re-answer it again. Is there any COVID-19 related signage that businesses are required to have posted? So none that I know of that you are forced to post, unless you are. The only one that I know of is if you are a nursing home or an assisted living facility that has an active COVID-19 case going on in the building, then it has to be posted to warn people that person's in there. But otherwise, I don't know personally of any signage requirements. All right, that's the question, Samantha.
Awesome. I have two other questions that have come in that we have not touched on yet. Can a contact of a positive person still report to work utilizing a mask instead of a 14-day home quarantine?
No. If they're a contact, they're going into 14-day isolation.
All right.
Or quarantine, I should say, yeah.
Yeah. And then on any of the
now contact, when I use the word contact, that's a health department defined contact. It has to meet certain criteria. So that would be the health department telling you you're a contact and you have to go into quarantine.
Okay.
Not somebody you pass on the street at random.
Got it. Thank you for clarifying. And one other question came in. On any of the resource websites, are there bullet point recommendations for certain types of businesses? For example, if I'm a retail store, I should do these things to open up safely, 1, 2, 3, etc. So are there any specifically defined resources anywhere for specific types of industries of what they should be doing? Because obviously not, wiping down menus doesn't apply to a retail store. So
correct.
I guess, are there any specific resources anywhere, CDC or anything?
Yes. So what I'd recommend people do is on that helpful resources slide, you go to the one that says guidance business response, community and business response, and that can get you into the other ones. They do have specific business guidance, especially for grocery stores. There's a whole webpage devoted to that. It's long, but there are some bullet points in there. And also the CDC reopening guidelines that have been so controversial in the news. Those are the ones that the CDC tried to release and then supposedly they couldn't. And now they came out, but they came out like last night. I was lucky enough to be able to see some of the original versions, but what I understand is the ones that got released are actually bullet points. They made the CDC folks condense all that stuff down and put it into bullet form. So, but I haven't had a chance to review those. So I'm not sure what's out there and what it covers, but I believe it covers grocery stores. So, awesome. That might be a good place to go and look for that. And that should be on the CDC's webpage. It might be under the Plan for Reopening America page too. Okay,
perfect. We'll take a look. All right, well, those are the last two I received. And so I just want to go ahead and thank everybody for joining on today. After the webinar, we are going to send you Robert's contact information as well as the PowerPoint slides today, so you can still have access to all of those links from the Department of Health. And Robert has told us that he's happy to answer any questions if you have any concerns, or if you want to continue a one-on-one conversation, to reach out with him and get any of your questions answered. So with that, I would like to say thank you, Robert. We appreciate your time today.
Yeah, thank you very much for inviting me.
Yeah, absolutely. And thank you for clearing up some misconceptions and talking with our businesses today. And thank you, everybody, for hopping on. We're going to go ahead and call it a wrap. All right. Thank you. Have a great Friday, everybody.